understand that if it's a young kid, you just may want to think, okay, is there something going on in the hip, and we'll go over all the imaging and stuff for that. But mainly, I do most of the hip exam in supine. So go ahead and, yeah, is it your left leg or right leg?
Toward above.
Both, okay. All right, so what I like to do is just simple, this log roll, just see what their range of motion is like. Because sometimes you get on there and you try to just slightly internally rotate them a little bit, and they're acting like that hurts really bad, or they're just super tight. Now, there are times where someone has like a hip infection, where when you do this, so lift your right glute up off the table, like they'll try to fight you like that. That would not be normal for like a teenager or older kid. That would not be normal. Just they should all have just a normal log roll. Then what I like to do is just simple straight leg raise. So go ahead and bring that leg straight up. Don't let me push it down. Keep it up strong. Everybody should be able to resist you. So if you push them to the ground, that's significant weakness there. So that's good. So what are we looking for with a straight leg raise? What's major muscle that we're testing? Straight leg. Rectus femoris, yes. Okay. So then, if you give them a little bit of external rotation, and then do again the straight leg raise. So go ahead and bring them up. Don't let me push them down. What are we testing there? Heard it? Sartorius, right? Okay. So we got sartorius. Okay. Then what I'll do is bring them up 90 degrees of flexion and go ahead and push against me. And I'll say push towards the wall or whatever, and then that's more iliopsoas there. Okay. So that's how I'll kind of differentiate. Because a lot of times people are just like, oh, it kind of hurts, randomly in here. Then I will just bring your legs straight up, bend your knees, sorry. Good. Go ahead and push together.
Ooh, that popped.
Go ahead and pull apart. Good. You know what I always tell people? If I can't hurt you, I can't help you, okay? So sometimes people are like doing this like, okay, is that hurting? You really want to get them going with a good exam so you can see if that's sore or not. So then I'll go ahead and bring them up. So you got flexion, adduction, internal rotation, flexion, abduction, external rotation, so Faber and Thayer, just looking at that range of motion. Someone with a labral tear, what I like to do is just an axial load test. So you're axially loading the femur and just seeing if you can get to see if they have pain. He's got pretty good strength, so he's probably been at PT strengthening this hip up.
I didn't go.
You didn't go?
No, I tore it when I was in high school.
You're just a strong dude?
I just said nah.
No. So then also, and I know I'm doing kind of the normal exam out of order, but really focus on your palpation here, because a lot of times people will, be complaining of hip pain, and you're thinking here, and then they're more talking laterally. So you want to start your iliac crest to make sure. Sometimes people have iliac apophysitis, just like your patella tibial tuberosity, just like the fifth metatarsal. You can have that same concept at the iliac crest. Then you come down, you feel that ASIS, so what attaches there? Sartorius, okay, Sartorius, ASIS. A little bit lower down, you got your AIIS, that's rectus femoris, right? Then those are the main kind of landmarks that I'm looking for. I like to do lateral hip on the when on their opposite side. So go ahead and lay on this left side. And so I'll go ahead and test their strength. So go ahead and lift up against me. Good. See if that bothers them. And then just get them to relax here. And I like to start iliac crest. Then you've got what here? What's that? Glute med. And what else? That's more TFL. Okay. Glute med also attaching in the greater trochanter. Then coming down, just get right over top of that greater trochanter. So nowadays, a lot of people are arguing that it's not really greater trochanter bursitis, it's more glute med or glute max tendinosis, but the treatment concept is the same. And then just kind of palpate them all the way down and seeing if that bothers them there. There is this test called Ober's test, which I really don't like that much. I think it's just subjective. So holding the foot here at the level of the greater trochanter, and then just seeing where, if you just let them relax, just see if the knee falls down to touch the other leg. But I think it's just, they contract their muscles too much to really say for sure. I mean, to me, I think if you can just palpate all the way down and see, is that tender, is that not, that should be sufficient. I will have them go prone for a second, and then just check that range of motion, and go ahead and push me to the sky and see if that bothers them. Good. All right, and then what muscle will you find if you go greater troch and come laterally right in the middle of piriformis, right? So right in there, you want to see if that irritates the sciatic nerve, because sometimes you can have irritation in the sciatic nerve, but we'll also talk about piriformis syndrome as well. But usually right in there, biggest thing is just got to get them to relax, because they just want to tighten that butt up, and you just guys just relax. But usually you can get in pinpoint, is that the area of pain? Sometimes people will have irritation on the quadratus lumborum as it attaches to the iliac crest. How I like to test that is just a side plank. So go ahead and give me a side plank there, because you'll do your whole exam, and then they'll be like, yep, that's the spot right there. So that can sometimes happen in like runners and things like that. You're a strong dude. You were right. You didn't need to. But that's kind of pretty much, my hip exam. Is there anything that you guys